Today is an opportunity to reflect and say thank you. Later this week, on March 19th, the Roanoke City and Alleghany Health Districts will observe the 2-year marker since the first case of COVID-19 was identified in our health districts. Today, we are remembering those we have lost to this deadly disease over the last 2 years, as well as thanking our healthcare and emergency services partners for their tireless, ongoing work in the pandemic. Before we begin, I'd like to acknowledge a special guest with us today, Dr. Molly Odell, who came out of retirement to lead this agency as interim director from those earliest days of the pandemic through the fall of 2020. Thank you, Molly. And now for opening remarks, I'd like to introduce Dr. Cynthia Morrow, RCAHD Health Director.
Thank you so much. As we reflect on our 2nd-year anniversary of COVID in our community, it's important that we honor the impact that it has had and that we give thanks for the progress that we've made over the last 2 years. Today, we are thankful that the Omicron surge is receding. We are hopeful that our case counts, our hospitalizations, and our mortality associated with COVID-19 will continue to decline. We are thankful that we are so much better protected today than we were a year ago, and certainly than we were 2 years ago. Thanks to extraordinary vaccination efforts, we have over 90% of our population of Virginians protected at some level against COVID-19, either through vaccination or through infection. We are thankful that we have more medical options available to us for those who may still get COVID and who are at risk for poor outcome. And importantly, we are so thankful that we've been able to build sustainable partnerships that will not only help us to protect our community when a new variant arises, but that we can count on each other to continue to work together to improve our community's health for any infectious agent, for substance use disorder, for any number of health threats. We are thankful, but we are humble. We know that COVID-19 is still with us. We still have 20 people in the hospital today, and it is likely to remain with us for the foreseeable future. And we know how much COVID has taken from us. Over the past 2 years, COVID has overwhelmed our first responders, our healthcare workers, our emergency rooms, our hospitals, our ICUs, our human service agencies. It has isolated our children and our older adults. It has relentlessly challenged our schools in ways that we couldn't have fathomed. It has disrupted our businesses, our restaurants. All told, COVID-19 has hurt our hearts and our minds in unimaginable loss. And with this, I'll pass it over to someone from the front lines.
Next, I'd like to introduce Jason Ferguson, Fire and EMS Chief of Bottot County. It's fitting that Jason is here to speak on behalf of emergency responders, as the first locally recognized case in our health districts was in a Bottot County resident. Since then, Bottot EMS has played a critical role in our collective pandemic response. In addition to their primary work of responding to calls, Bottot EMS has played a tremendous role in our testing and vaccination efforts and was among the first responders providing in-home vaccinations to shut-ins. As a result of their excellence, they received the 2021 Governor's EMS Award for Outstanding EMS Agency. Jason, could you come forward?
Good morning, and thank you for joining us on this somber occasion. as we pause to recognize the second anniversary of the first COVID-related case and the past 2 years of the pandemic. Today I stand before you as a representative of the public safety community and a segment of the frontline workers that were in the throes of handling thousands of cases of COVID-19 as emergency medical pre-hospital providers. The COVID-19 global pandemic has been one of the most monumental events of our generation. The impacts of this life-threatening disease have forever changed our society. As we continue to progress towards eradication of this virus, we must remain vigilant that it is still amongst us, as healthcare workers continue to treat this disease right now. I'm certain that every one of us remembers where we were the day the first case showed up in our communities. That feeling of disbelief, of concern and fear for what none of us could have imagined would unfold over the past 2 years. For emergency services, this became the largest public health emergency we had ever heard of or seen, an area that we rarely delve into, public health. Our firefighters, EMTs, and paramedics handle the worst of the worst daily, but the pandemic amplified the gravity of already taxing work that we do. Personal protective equipment changes and medical protocol developments were only a small part of the impact on our personnel, as the virus knows no stranger. Trying to maintain a healthy workforce to continue operating and caring for our citizens became a top priority. Isolation and quarantine guidelines, masking regulations, physical distancing, they all continue to evolve and leave everyone reeling for how we could protect each other and still continue to serve. Most of our EMS providers in the region traditionally work 24-hour shifts and live in the fire station a third of their lives. So the logistical challenges of how a group could be in such close quarters and not get each other sick became yet another component of our thoughts and efforts in trying to weather the storm. Resiliency in the face of adversity, that's where we expect to find frontline public safety providers every day. The pandemic was no different. This region's emergency responders became an even more relied upon integral part of the community than we had ever seen before. Emergencies, COVID-related or not, they all had to be answered. The men and women of this region's public safety providers carried on, bearing a great deal more than just the normal day-to-day stressors. Coming back home to your family at the end of the day looked different. It felt different. Might we be the reason one of our family members contracts this horrible disease, let alone die from it? These stresses were all too real, and the healing for emotional trauma has only yet to begin. No matter how this pandemic affected your specific community, we all know that it changed the world, our society, and so much about what we thought we knew of what we could handle. For every tragedy, there's always a silver lining to be found. Have you found the silver lining from this pandemic? If you haven't, the time is now. Seize the day to be thankful for all that we have. We are so blessed in Southwest Virginia to have the relationships that we do. The can-do attitudes and the partnerships are the ties that bind during times like these. On behalf of my colleagues, we'd like to say thank you to everyone that joined together to help to where we are today. We are proud to be part of the Roanoke Alleghany Health Districts, and even prouder to call Southwest Virginia home. We're here today on this second anniversary as we grieve for over 930 of our fellow residents in the Roanoke Alleghany Health District. Friends, family members, co-workers, and neighbors who have lost their lives. In the darkest days, many were not able to say goodbye to these loved ones due to the public health concerns or travel restrictions. We understand how painful this can be during an already difficult time of grieving. It is important that we pause, reflect, and remember each person we have lost. We hope the chairs set out today each signify a precious life lost, serves as a visual tribute to the magnitude of the loss to our community. Please join me in observing a moment of silence for those that for those loved ones that we have all lost.
Thank you, Jason. Next to speak on behalf of our brave healthcare providers and dedicated volunteers is Dr. Conrad Claytor. 2 years ago, Dr. Claytor had just wrapped up a 30-year career and had entered retirement. Seeking to give back, he joined the Medical Reserve Corps and has since volunteered at numerous vaccination clinics, including right here and at sites as diverse as local churches, the Salem Fair, and even at the Roanoke City Jail. Speaking on behalf of our frontline healthcare providers present here today, as well as the hundreds of volunteers who were essential in the pandemic response, is Dr. Conrad Clayton.
Good morning, and thank you, Christy, for those kind words of an introduction. Let me start by giving a heartfelt thanks to all the volunteers. You are greatly appreciated every day. Also, a very special thank you to the National Guard, Fire and EMS, the AmeriCorps, and the venues that provided a facility to accommodate our community outreach. And also to the leadership and the support by our local and state Department of Health. As a physician, I can relate to the toll that COVID-19 has taken on my colleagues in the healthcare field. Since the beginning of this pandemic in late 2019 and early 2020, healthcare workers have provided care to patients despite physical exhaustion, mental exhaustion, personal risk of infection, fear of transmission to family members, and the illness or death of friends, colleagues, and of course our patients. Adding to this burden were additional sources of stress and anxiety associated with long work hours, increased workloads, addressing family needs, homeschooling, and for some, caring for an elderly parent or high-risk family member. It was such a relief to welcome the arrival of not just one, but 3 vaccines to fight this virus and to prevent illness. I am encouraged by the spirit and the teamwork that I have witnessed and participated in. Thanks to the dedicated volunteers in our communities, such as the nearly 13,000 Medical Corps or Medical Reserve Corps volunteers throughout the state, we can finally see the light of day in combating this pandemic. I'd like to share a very quick personal story. Unbeknownst to me at the time, I began my journey as a volunteer working in my dad's medical office. I was about 8 years old, and I was excited to head straight to his clinic after school each day. I was imagining all the exciting things that I was going to get to do in his medical practice, only to be given the responsibility of cleaning the treatment rooms, cleaning the bathrooms, and taking out the trash. However, as I grew older, my responsibilities included manning the front desk, scheduling patients, assisting him in treatment rooms, and also learning instrumentation and sterile technique. Mind you, all of this was free labor, so hence my introduction into the world of volunteerism. I learned so much during those years working with my dad, who was an internist, and my uncle, who practiced OBGYN. The satisfaction of helping others was seeded into my heart, and I learned that every job performed was an integral part of accomplishing any goal. Let me say that again. Every job performed is an integral part of accomplishing any goal. When I began my practice in 1988, I felt it only fair that I afford my children the same opportunity I had working in the medical office. I'll also admit that it was an added benefit that it was free labor. I know it helped them, as it did me, to mature and to think beyond the needs of oneself. Now that I've retired, it is gratifying to still be able to help during this pandemic. Please take time to reflect on what being a volunteer has added to your life experiences. Being a volunteer, to be a part of a process that helps so many, and knowing that you made a difference, is a satisfaction that cannot be bought or taught. It has to be experienced. Please continue to volunteer and encourage others to join you. Thank you.
We now would like to offer our appreciation to various agencies that have helped us so much over the last 2 years. First, we'll be calling on emergency EMS services. Alleghany and Covington could not be with us today. Our colleagues are still reeling from the tragedy of last night. They are in our hearts today. Bottot County, can you please step forward? There you go. Craig County EMS. Roanoke City EMS. Roanoke County EMS. Salem City EMS. Thank you for your services. We'd also like to express appreciation for our healthcare systems. Carillion Clinic, Lewisdale Medical Center, Veterans Administration Medical Center in Salem. Thank you so much for your services. Emergency Management, Virginia Department of Emergency Management. Western Virginia EMS Council. National Guard could not be here today, but they were an unbelievable resource for us, and we wanted to acknowledge a recently retired Chief Warrant Officer Stone, who, for those of you who are at our mass clinics, was there every step of the way. Thank you all so much. And it's so important that we honor and thank our volunteers, the Virginia Medical Reserve Corps, and therapists of Roanoke Valley who made many children smile as they got their vaccines. In addition to these partners, we also want to recognize so many others who have contributed so much to the well-being of our community over the last 2 years. Our other critical healthcare providers, such as Radford Free Clinic and New Horizons, the numerous community-based organizations that were critical in mitigating the impact of the COVID-19 pandemic, our school administrators, our local elected officials who are with us every step of the way, the amazing teams at the Roanoke and Salem Civic Centers who opened their doors to allow us to provide mass vaccine clinics. We are fortunate to live in a community where we have so many organizations, so many volunteers, so many people who are committed to working tirelessly to promote the well-being of our community. The last 2 years have presented relentless challenges for each of us, and we still have many challenges ahead. As we transition to a new normal, one in which we can expect sporadic waves of COVID-19 activity, we need to consider, one, how we protect against the threat of any new variant, how we minimize the health impact, how we decrease hospitalizations, and how we decrease deaths. We need to prepare for these new variants. We cannot let our guard down. We need to determine how we minimize the impact that new variants may have, how we can minimize community transmission. We need to be able to prevent our businesses and our schools from closing. We know how devastating that impact was on all of our community members. And we need to work together to enhance community resilience by identifying systematic approaches to address some of the unmet mental health needs that continue to threaten our community's health. In closing, we don't know what the future holds. We don't know what the next wave might look like if the next wave happens. But what we do know is that we can count on each other and face whatever challenges we have together. And for that, I'm thankful for all of our partners. Thank you so much.
That concludes the remarks that we have this morning. I think one final point of privilege is that we'd like to thank the media, who you all have helped us communicate messages to the public. We're very grateful for that. Thank you. We appreciate that very much. Appreciate the work that you've done.